Link between diabetes, heart attacks and strokes. Diabetes is a disease in which the body either lacks insulin or does not produce enough insulin to break ingested glucose into cells. As a result, the glucose remain in the blood and damage blood vessels. A high content of glucose in the blood is called hyperglycemia and is often a precursor to heart attack and stroke. People who have diabetes have twice as much of a chance of having a heart attack and stroke as those without this condition. In addition to diabetes itself being a risk factor for heart attack and stroke, there are other risk factors that people with diabetes should be aware of to reduce their risk factor for heart attack and stroke. This includes central obesity. Studies by the American Heart Association have indicated that while obesity in itself is a risk for a heart attack, carrying excess weight around the waist increases your risk of heart attack. This is believed to be due to the fact that abdominal fat increases bad cholesterol more than fat on other areas of the body. Speaking of cholesterol, those with diabetes should carefully monitor their cholesterol carefully. Because the blood vessels are already weakened by the excessive glucose in the blood level, people with diabetes have to be especially careful about their cholesterol levels as their arteries can become blocked easier than those without diabetes. Monitoring cholesterol is important for everyone, but imperative for those with diabetes. Hypertension is also a dangerous condition for those with diabetes and can lead to heart attack or stroke. Damaged blood vessels having to work harder to pump blood from your heart throughout your body can cause heart damage, stroke, and even eye problems. Clearly, those who have diabetes must not only carefully monitor the disease, but complications that can rise from diabetes. While it is important for everyone to check their blood pressure, cholesterol and maintain an ideal weight, it is even more important for someone who has diabetes. In order to reduce the risk of heart attack and stroke for people with diabetes, it is important, first of all, to manage the disease. By eating proper foods that are recommended for people who have this condition, exercising and taking your medication, you can maintain a good glucose level in your blood that will reduce your risk of heart attack and stroke. By monitoring your cholesterol and blood pressure and seeing your physician on a regular basis, you can stop a potential problem before it begins. By empowering yourself to learn all you can about managing diabetes and complying with the instructions of your physician, you can live an active and long life with diabetes. Knowledge and facing the situation is the key. Those who refuse to follow advice, who prefer to eat whatever they feel like, not exercise and pretend that the disease does not exist, put themselves at the most risk. Type 2 diabetes is reaching epidemic proportions in the United States. It does not have to be a killer. People who follow instructions, learn about the disease and comply with their physician have an excellent chance at reducing their risk of acquiring any of the complications associated with this disease. Despite the link between diabetes, heart attack and stroke, those who maintain their health can avoid these conditions. If you like the video, give it a thumbs up and share with your friends. If you want more recipes and tips, subscribe to the channel.